Okay, so before I start, full disclaimer, right? I'm going to talk about topic and even show you images that usually you don't consider, you don't want to see, because nowadays, for most of us, it's easy to lock up your room and then flush when you're done, and probably even have a spray to get rid of the odor when you're done. But I'm going to delve into it as raw as it is. So pardon my language, is going to be very blunt as it's supposed to be in the area that I'm working in. All right. So to start, I just want to give you an excerpt from, if you've read Trevor Noah's book, Born in Crime, this excerpt really speaks of what exactly I'm talking about. So I'm going to read a bit. Now, when you shit, as you first sit down, you're not fully in the experience yet. You are not yet a shitting person. You're transitioning from a person about to shit to a person who is shitting. You don't whip up your smartphone or newspaper right away. It takes a minute to get the first shit out of the way and get in the zone and get comfortable. Once you reach that moment, that's when it really gets nice. It's a powerful experience, shit. There's something magical about it, profound even. I think God made human shit the way we do because it brings us back to earth and gives us humility. I don't care who you are, we all shit the same. Beyonce shits, the Pope shits, the King of England shits. When we shit, we forget our airs and our graces. We forget how famous or rich we are. All of that goes away. You are never more yourself than when you are taking a shit. You have that moment where you realize, this is me. This is who I am. You can pee without giving it a second thought, but not so when shitting. Have you ever looked in a baby's eyes when it's taking a shit? It's having a moment of pure self-awareness. This is something that you can reflect on. But the idea is, I'm going to explain to you about, this is a research, right? I'm going to talk to you about this in the form of my journey from where I grew up to where I ended up today. Now, we're going to talk about sanitation through my personal experience, right? Starting from Ghana right to South Africa. Now, fun fact, what you didn't know is that the design of the toilet, as you see it today, conceptualized, is the meeting of the female and male genitalia. If you look at it, the bowl is supposed to be a representation of the female genitalia, and the pipe that connects to the, how do you call it, sewage system is supposed to be the male genitalia. That is the concept behind this, what you use every day. Now, so I started from Ghana. I grew up in an area such as this. It's changed quite considerably, but still has the same characteristics. So this is a town which is sort of like an informal, largely informal neighboring town to an industrial city called Tema. Now, in that town, what we're familiar with is these types of sanitation systems. It's quite comprehensive. The one at the bottom is actually for free. The one at the top, usually you have to pay for it, unless you are lucky enough to have a friend, family member who owns one, which was usually scarce at that time. Now, the options that you're looking at, it is only as bizarre as the person who is observing. And usually the person coming from outside who has experienced something else, it's very bizarre. But for us who live in there, that's what we're used to and nothing to compare to. So it's usually okay. So once upon a time, I went with my stepbrother to a city where I asked, I want to use the bathroom. Then they ushered me into a small room. It has its own room. Then he said, go in there. I'm like, so they locked the door immediately. And there was this white thing with clean water in it. So I stood there for a while, confused as to what to do. After a while, they asked me, are you done? And then they opened the door. I'm like, I'm not sure what exactly I'm supposed to do. There's this white thing and then there's water in it. I don't see where I'm supposed to urinate. So everybody burst out laughing because at that part of the country, that type of system is popular. So they said, no, you do it in the water. I'm like, but the water is clean. That is clean drinking water. They said, no, it's okay. Just doing it and then leave. So I did my peeing and then I didn't flush. I just left them like, okay, now the water has changed color. What do I do? I said, no, you press a button and then more clean water will come. Like, such a waste of clean water. Now, Characteristics of such toilet facilities were that they were indoors and they were usually characterized by clean water, right? And based on your experience, especially when you've had this white enamel with what clean water in it for so long, you tend to dismiss the lived reality of other people and just call them poor sanitation. But there's more to the story than that. And that's what we're going to talk about today. So started from the journey from Ghana with my lived experiences, gone to a number of countries, and then ended up in South Africa. Now, this is where a lot of toilet cultural shock took place for me, right? There's a lot of incidents of what I refer to as conflicting realities, right? What we found as a scarce commodity was very abundant in Cape Town, but at the same time, in Cape Town, it was regarded as a scarce commodity. So what exactly is the problem? I have to start from the basics. From the basics, if you look at this graph, WHO will say these are the people that do not have access to basic sanitation, right? Based on percentages. But then what it doesn't show you in detail is what they define as what basic sanitation is. So I went in deeper. This is what the WHO defines as basic sanitation. So they will say you have improved sanitation to a certain percentage if you have flush or poor flush toilets, ventilator and improved pit, if you have pit latrine, composting toilet, or shared facilities. Unimproved is anything that is pit latrine without a slab, hanging latrines, and bucket toilets. And the one that they don't want to deal with at all is open defecation. That's what they want to get rid of completely. Now, when you look at all of this, technology seems to be the base indicator of what improved and unimproved sanitation is. But then you go. I started my trip without knowing exactly what I'm going to study in Cape Town. So I made a couple of visits to the informal settlements. Now, you see from flush toilets, right? What the WHO defines as a flush toilet in the open without any enclosure in some of the informal settlements. Then there was these blue containers that was not in any of the characteristics they put in there. So what is sanitation? Then pay observation and enter the bathroom in UCT library and saw this. A student did this and finished and left without even flushing nothing or removing the tissue. I'm still wondering, what exactly is sanitation? Since I'm observing this in one of the highest standards of tertiary education in the continent. Then this was also a common characteristic that baffled me. I have never been to or heard of any country that protests because of toilets. But look what they are protesting about. It says safety and security begins with what? Safe toilet. So me coming from Ghana, my experience from Kenya and other countries, what has safety and security got to do with this? So I still ask the question, what exactly is the sanitation problem here? Then I realized Cape Town has this different perspectives, right? There's this perspective that you can see on YouTube and other visibility. And then there's the other perspective that is also shown completely in other media. All of them have different stories and you can't just immediately point at one finger. And that's one of the best things I learned about this. You can't just say this person is wrong or right without full understanding of what the problem is. So I began this study of trying to understand what exactly is happening. Now, coming from a background of putting together survey instruments, going to the field and asking people questions, my supervisor was like, no, what questions are you even going to ask the people? You don't know. So, okay, I'm going to spend 5 months in there. I'm not going to ask anyone questions. I'm just going to walk around and spend some time seated at some of the public ablution facilities. So I spent a lot of time walking around, just observing, making friends, sharing meals without necessarily saying, I'm going to ask people questions. No, just observation. And that brought in a lot more information than I could have ever imagined. So I spent about 5 months in 2 public toilet facilities. And then it is based on what I observed that I now decided to interview over 1,000 residents in the informal settlement, and then did another about 50 key informant interviews. Now, this is the map of Kailija, where my study was focused, right? It's a very small section in Cape Town, South Africa. Now, zooming into the details, you see these are the areas I was focusing on. Now, this blank area that you're looking at here at that period had caught fire and they had to raise the whole place down. That's why it was empty. It didn't take up to 3 months for the whole place to be filled back up with houses. So no matter what the tragedy happens, this place is usually a fire hazard. No matter what tragedy happens, people always rebuild at the fastest rate. Now, this is another closer look at the settlement. You could see some disparities from the bottom picture and the top picture. The top picture are settlements that they are beginning to do what is called in situ upgrades. So they upgrade their houses to what it was referred to at that time as matchbox houses, because the houses look like matchbox. So they're rectangular, just houses, and then they fill in with their house, all the materials they need to live in a house. Now, so I began the ethnography journey. So spend time in two toilets facility. Just some basic observations that I'll talk to you about, right? We have the bathrooms, we have the urinals, children, we have the hand washing facility, and then we have the laundry area. And this is the schematic of how the flush toilet actually looked like. Now, for anybody who's designing these systems, their interpretation of what materials to use, how to set it up, their length, all of that, it means something completely different from the user. And we'll get into that. So these are the sanitation options available to the residents. So they have a public ablution facility, public toilet. They have shared flush toilets, so they can have one flush toilet that is shared by multiple households. They have what is called porta potty, which is this container you are seeing on the right here. And that also comes in different designs. We have open defecation, which was an option for a lot of people. We had what we call flying toilets. That's when someone defecates in a plastic bag, rolls it and throws it over the fence. Then we had what is called chemical toilet. And these were the blue ones that I showed you some time back. Now, this is the structure of the public ablution toilet that I spent time in. So you could see that the male side had 3 bathrooms, the female side had 4, right? But then the males had 2 urinals. Now, I did a lot of observation. For example, women spend more time in the bathrooms than men. On average, women spend 5 to 10 to 15 minutes than men spend in the bathroom. Most men go to the urinal, which is quick, and then they're done and they're gone. Now, most of them actually wash their hands before they get out. Now, whilst I was working on this, there was a project that was initiated to teach people in that area how to wash their hands, to encourage them to wash their hands. So I did observation and realized people were actually washing their hands 100% of the time. They were washing their hands after using the bathroom. Then there was something unique that happened. It got to a certain period that they stopped washing their hand as much as they used to. That was baffling. Like, why? So I observed and realized, oh, the seasons have changed. It was now winter, and the water that was coming from the wash basin was actually now cold. So people were avoiding doing that. So the solution to a hand washing program was to just warm up the water, find a way to heat the water in the public bathrooms, and then people will continue washing their hands and not have a whole workshop to teach them how to wash their hands, because people already knew that and were inclined to cleanliness. So you can see from many feedbacks that people gave in ethnography, cleanliness is one of the key things they look out for what is defined as a good sanitation system, right? They look for safety, hygiene, germs-free. Someone says because they like it, disease-free, clean, and private. So all these begin to define the characteristics of what a good sanitation system is. Again, went further, when you break this down, gender plays a major role in what someone defines as what is the best sanitation system. In the Kailicha settlement, safety was #1 for women, right? But for men, it was either cleanliness or the particular type of toilet. So that differentiation, if you don't pay attention to it, you might be supplying sanitation system to everyone else without paying attention to what functions they actually provide. Now, the most gruesome example of this is the lever that is on a toilet facility door is the reason for a lot of security problems in the settlement. Women were murdered in those toilets and raped. This is one of the cases because the latch for locking the door can be open on both sides. For the person who designed it, they're just creating access, lock inside, but they didn't think about the fact that someone can actually come and open the door whilst you're inside without knocking. And this is the result of that design. Now, so you could see from this picture here, the latch, as I was showing you, this was something that could be opened both from inside and outside. So if you're inside and you lock yourself in, someone can come and open from the outside and see what will meet you in there. So the city is definitely trying. When you interview them, yes, we're trying, we're providing this and that. But what I wanted to understand is, why do they provide the type of technology systems that they provide? When you ask the city authorities, they'll tell you, we provided them with toilet systems and it's theirs. They are supposed to take care of it. But most of these systems are labeled as property of the city of Cape Town. So it is not this, and there's no evidence to show that they are actually thinking of them owning these systems. Now, these are the main ways people actually defecate in the informal settlements. So majority of them still go to the push. Now, this is not just people picking one and sticking to it. Some people use the flush toilet sometimes, some people use open defecation. Sometimes the use of open defecation is not because the flush toilet is not there and not working. Especially at night, people will prefer to go to the open because they are able to see around them in case anybody is approaching, so they can run. But in the flush toilet, someone can open the door without you knowing whether someone is coming. So that's what influenced the preference of which method to use for defecation. So they had buckets, and there are different types of buckets. They go to the river, they use the chemical toilets, they use the flush toilets, they use a nearby highway, which is open. They use what is called porta potty, and then a public ablution. Now, you can break down even in the open defecation, different ways in which they do that. So from all the studies and from looking at the ethnographic data and the survey data, this is what we realize. These are the functions that they use to define what an actually useful sanitation system is. Now, a number of engineers that I spoke to that worked on this, actually, this is not a thought that comes to them. They are thinking of privacy, safety, comfort, lighting, order, cleanliness, hygiene, dignity. Now, the dignity part is a complex one they don't understand. For example, we asked a woman in Kailicha, what do you define as good sanitation? You have a flush toilet. What is the problem? It's like, no, I want the one that the white man that I'm cleaning his house, that nice one with tiles, that's the one I want, and I want it in my room. That's what she wants. It's a sign that I have been given dignified sanitation. So the word dignity is thrown along when it comes to the issues of sanitation in informal settlements in Cape Town. So what I endeavored to do is find a way to design a SaniFun model, right? Sanitation function model that looks at all these functions. What are the inhibitors and enablers, and how does that influence things like supply chain, finance, planning and design, engineering, all of that. So that's what I was working on. Now, so when we talk about sanitation, the question you should ask is, what exactly do you know? When I first entered this settlement, they said sanitation was a problem, but I saw back-to-back 3 kilometers of full flush toilets that were looking like this. Some of them were locked because they had given the key to some households that some specific households were sharing. Some were open and broken down. But albeit, they had this full row of systems. So the question again was, what do we know and on what basis are we deciding what is good sanitation? Also, all these systems, most of them were lined up at the periphery of the settlement, which means ownership was not for anyone. It was not owned by anyone. You will have access, the key to a particular toilet. As you can see, some of them have locks, but anybody in the settlement can break them and use the toilet whenever they want. Now, so some imaginaries that people have about sanitation systems in informal settlements. An informal settlement user does not engage physically or mentally with their shit or its management, which is untrue. When there's no system at all, people actually make an effort to deal with their own fecal matter when they defecate or when they find means of doing so. An appropriate urban sanitation system requires flushing. That is also untrue. So just assumes that people are protesting that they want flush toilets, doesn't necessarily mean that what we have in terms of in our mind as a flush toilet is what they want. As long as it's able to meet the functions of a good sanitation system as they indicated, then that is what we'll define as appropriate sanitation. Systems that require users' engagement with their shit and its management signify rural, underdeveloped, and backward lifestyles or oppression. Albeit a lot of these technologies that are being developed for sustainable sanitation, all of that, they're actually not ready. But these informal settlements are usually used as testing grounds for these systems, thereby increasing the problems that they have. So the fact that you're in urban area doesn't mean you can't use this sustainable system, but it still has to make the functions of what is an appropriate sanitation. Urban sanitation is a state responsibility, not a local one, which is also not true. Where the state does not fulfill its responsibilities, people do take up, make the effort and install their own systems. And I have seen several examples of that. People install their own systems in their own homes. All flush toilets are equal. No, all flush toilets are not equal. Again, the functionality reflects the definition of what a flush toilet is. So a flush toilet that is made up of enamel with clean water that is available all the time is different from one that is made from plastic from a particular area. The space in a particular toilet where a person can sit comfortably and defecate is different from the space in another one that is all tiled with an open bathroom. Where you put the tissue paper in a bathroom affects the comfort of a person sitting to defecate. There are so many factors. Health is only about E. coli. No, sanitation, health is not only about E. coli. There is also the perception of dignity, which will affect the quality of health when we talk about public health. Technology is not a social construction. Technology is definitely and always is a social construction. That social construction can either be imported, locally produced, or manufactured in some way. So whatever sanitation systems you see everywhere is based on a social perception of what an appropriate sanitation is supposed to be. A toilet has nothing to do with culture, which is also not true. If I read a PhD thesis on the scatologic right of nations that was written in the 1800s, and it gives you a clear example of how different cultures practice defecation in different ways that are usually also tied to some religious beliefs systems. So a toilet facility always has a cultural significance. Now, so this brings meaning to me for one of the protests that I witnessed, which said safety and security begins with safe toilets. And on my investigation, these examples and many more of people being attacked in toilets gave me for me to understand this is why a lot of toilets are actually destroyed, or people refuse to use them in a number of these settlements, or they are not properly managed in this settlement. So that bit, I think this is the end of my presentation. I welcome any questions and thank you for listening.